This is Pod Populi.
Podcast for the people.
Hey everybody, and welcome back to another episode of Hybrid Healing Hour. Today we are going to be talking about a very big topic that we're seeing a lot in our clinic actually, and that is resistance to weight loss. So we know that everybody out there is on a GLP-1 or like Ozempic or Wegovy, Mounjaro, and Zepbound. So when people reach a certain point and they reach their goal or they hit a plateau, it can be very discouraging. But we have a very special guest with us. It's pharmacist Hayden Collier. So why don't you go ahead and tell us a little bit about yourself, how you got to where you are today, and then we're going to dive right into this.
Sounds great. Thank you. So yes, my name's Hayden. I'm the clinical director with New BioAge. Right now, I get the great opportunity. I get to talk to doctors most of the day and help them and help coach them about certain peptides and compounds that we have available so that they can have patients have some great clinical outcomes. Yeah, and resistance to weight loss is something I talk about daily that a lot of providers are having. That patients, either when they start GLP-1, they're just not having results, or patients who do get results with GLP-1, they get off, and then unfortunately they gain a bunch of weight back. And then when they get back on the GLP-1, it doesn't work as well as it did before. So, we have some treatment therapies and just some plans that patients can do so they can have that success like that they're looking for in particular. So, I've been a pharmacist now for 8 years. I started off in the retail world. I worked at Walgreens and Winn-Dixie for a long time. And then I was lucky enough that one of my mutual patients with Frank, the owner of Progress, he said he was looking for a pharmacist, and he's like, oh, I know a guy. So I went and met him and saw what they were doing, and I kind of it was right up my wheelhouse. I've been working out since I was like 14 years old, so I've always been in the health and, exercise space. So it just kind of fit like a glove, and then I kind of, fell in love with all the peptides and
absolutely. I mean, this is where medicine is going, and standing behind a pharmacy counter, popping out big pharma pills and counting them all day and giving advice on all the side effects people can have. Like, trust me, I was a pharmacy tech for 16 years at Walgreens, so I know.
You get it.
And I get it. And it's like, that's just not fun. It's,
And you guys are our number one source of information because, one, no physician is taught this in medical school, right? Even now, it's never mentioned in medical school. It's very hard to pick up information on your own. I mean, there's plenty of stuff online, but who do you trust? So we come to you, and we learn so much from you and other clinical pharmacists.
I appreciate that. Yeah, I know we try to go to every conference. We try to stay ahead because, the physicians will go to these things as well, and they learn all this cool stuff, but then it's how do you implement it, day one? And we're pharmacists, so we think about dose, side effect, contraindication, some things that they don't teach at the conference, but we want to make sure that we're ahead of the game when they come back so they can easily implement these things into practice. So, yeah, we're lucky enough we get to do, all that as well. And, Leonard, our founder of New BioAge, he's a faculty member with a bunch of the peptide organizations and stuff. So we really, meet some cool practitioners as well who are at the head of the game. So we kind of get to stay there and, help, like you said, the physicians, because you can't just Google this stuff and learn from a trusted source. It definitely goes a long way.
Yeah, there's definitely a lot of other misleading information out there as well. Actually on that note, like, can we kind of talk about peptides? Like, what is a peptide? Can you explain that to our audience?
So simply enough, it's just a group of amino acids that come together. Once you start getting larger groups of amino acids and larger peptide molecules, it turns into a protein. So this is just like a signaling molecule. Usually, anything under 40 amino acids, they consider a peptide. Anything greater than that, gets classified into a biologic in particular. But, peptides are just small molecules, signaling molecules that the body generally mostly already uses that have certain functions.
Exactly. So they're pretty much natural. I mean, we have amino acids all throughout our body. And so you guys are kind of like, well, in order to make a peptide, you can pull different amino acids to formulate a new peptide medication kind of thing.
Yeah, so that's where a lot of the large API companies, they synthesize them because they're able to put the amino acids together. So yes, they're natural, but all of them mostly are made synthetically. But they're safe. Side effect profile wise, most of them are tolerated extremely well. And that's what we really like about them.
Yeah, that's something we've noticed in our practice. We use a lot of different peptides, and we rarely ever have side effects. You have side effects to every other medicine out there, blood pressure medicine, cholesterol medicine, but it's rare with the peptides.
Well, and there's like, and same with when I have people who have multiple drug reactions, like when they're allergic to a list of 10 different medications, and typically providers are like, well, I don't want to try anything because you're going to have a reaction. Like I typically see people do phenomenal with peptides because they're natural. So let's dive right into what are, I guess, the main reasons you see that people become almost like resistant to weight loss, even with one of these, top medications that you can lose about 20 to 30% body fat, or body mass, I guess they say.
For sure. So usually we see like there's 4 main reasons why. And it's usually due to stress management, sleep issues, gut health issues, or chronic patients just being in a chronic inflammatory status. And that all those issues will cause insulin resistance and then cause issues with either when it comes to energy expenditure and then the glucose uptake.
Absolutely. You're preaching to the choir. I mean, I think you already saw, like, we've done a gut health podcast. We love it. So if you haven't listened, go back and listen to it. I mean, we did a weight loss podcast. That was I think it was our 4th episode that we did. And we talked mostly about, how to lose weight, but we talked about the medications. So today we're talking about the people who are probably already on some of these medications and not succeeding. And
plenty of patients have this misconception that all their friends are losing weight. All they need to do is just go on a GLP-1 and they'll lose weight. And then when they don't lose weight, they start panicking and freaking out, and then they blame the medicine and blame everything else but what the underlying cause is.
Yeah, and then, when they get off, or if they lose a bunch of weight, unfortunately, they're probably losing a lot of muscle mass as well. Their total energy expenditure goes down. The amount of calories they were eating to lose weight now, the inflammatory status has either come back, and then they try to eat the same amount, but they start gaining weight again, and it can definitely become it's a
vicious cycle. And that's why we are big advocates of doing the body composition, and we do that in our office because we definitely see muscle mass loss on these type of medications. So I know you're going to talk about this, but we're big proponents of building muscle, and you're going to talk about a few supplements or peptides that help with that. And yeah, it's just so sad. People get excited when they see the scale change, and I cannot drive home enough that I freaking hate the scale. Okay, the scale lies.
It's a liar. Yeah, it's a liar. Yeah, we have a metabolic clinic that we have a DEXA scan. We do metabolic breath testing as well, strength testing. So we try to get a full picture on patients when it comes to muscle mass, and even sometimes if they lose a little muscle mass, but if patients are getting stronger, that's actually a better indicator of their quality of muscle. And then the metabolic breath analysis as well when it comes to what patients' VO2 max is, but also like what they're using as a fuel source. Even at rest, you can tell when patients are metabolically flexible if they're burning 80% fat, 20% carbs, and you can look at those things and help determine if patients are ready to get off the GLP-1, and it's going to be a good indicator whether they're going to not just gain a bunch of weight back.
Absolutely. I love it. Oh my gosh. Yeah, we are excited. We actually love VO2 max, and we would love to be able to do that in our office, but we just don't have enough space yet.
Yeah.
Someday we will.
But yeah, so when it comes to, the resistance, usually, stress management, and it's the one that patients can most easily recognize, right? The world's stressful. Everyone's stressed fiscally, politically. World War III is about to happen, right?
I know.
Everyone's stressed.
So let's talk about cortisol actually on that note. So like cortisol, people look at it as like, oh my God, I need to see my cortisol level. Like, I don't find that serum cortisol is a true, a good test for that. So we can check, saliva and urine levels, I believe, are better. But cortisol is not bad, right? It actually has a lot of benefits, but people look at it as this evil thing.
Yeah, unfortunately, it's in a short amount of time, cortisol great with the functions that it has, but chronically, if patient's cortisol level is high, that's where we have issues when it comes to increased glucose levels, decreased insulin secretion. It has effects on beta cell death in your pancreas as well, decreasing the amount of insulin that you're supposed to be secreting. So it just kind of creates a high glucose state, and that chronically can have a lot of metabolic issues.
Right. So we have to work on stress and de-stressing.
And de-stressing, for sure. So, some compounds that we have available, I think one that I believe is going to make a great comeback just because of all the other pleiotropic effects, but is oxytocin. Oxytocin nasal spray in particular. I mean, the nasal spray is where they've done most of the studies, and they've even compared, they do have injection or IV available, but the nasal spray passes the blood-brain barrier better, but with this effect of decreasing cortisol. And, it helps prevent cortisol secretion, before, during a stressful environment, but also if they are stressed and cortisol levels are high, it will help patients decrease that cortisol level at the same time. So during and for prevention of that cortisol spike. So oxytocin is fantastic. You can do 1 to 4 sprays up to 4 times a day. So it's fantastic at decreasing stress in patients.
Most people think of oxytocin as the love hormone or the
Sure.
maternal hormone, but it has so many other effects.
Yeah, so in women it can induce contractions, for breastfeeding as well. But they've been studying it for many different kinds of stress, so like PTSD, prolonged exposure, social stress. They did a study where there was like 40 men, and they prolonged them to a social stressor, and they did like oxytocin 50 minutes before with social support, and then the other patients did just social support. And after the stressor, the patients that did oxytocin had a decreased cortisol level, increased calmness. So they've tested it. It's been extensively tested for sure.
Awesome. And our oxytocin levels decline as we age, and so does muscle mass.
Yeah, and that's what there's a lot of great studies now coming when it comes to decreasing oxidative stress, but also has an increase in like muscle regeneration as well. There's a study that they're doing in Navy SEALs where they're doing like an extraneous exercise, but they do oxytocin beforehand, and they're measuring like glutathione reductase activity in the muscle, and then they're talking about also measuring their VO2 max like a day after that like stressful or that extraneous activity to see if there's any decreases in it. So really excited for those results to be posted. But like I said, I think when it comes to maintaining muscle mass, decreasing cortisol levels, I think oxytocin is definitely going to have a place in a lot of weight loss programs, for patients that are either having issues or to help maintain muscle mass while patients are losing weight. I think it's going to be extremely beneficial. I
think it also has something to do with like the homeostasis. Think about when your body is very well balanced, right? When it reaches homeostasis, everything is cool, calm, collected, and can function properly. Right?
For sure.
But if we're in that fight or flight mode all day long,
yeah,
like your body's not going to metabolize properly. You're not going to build muscle when your body is trying to survive, right?
Yeah,
it's going to hold on to the fat,
It's just trying to increase glucose, so that fast energy source as long as possible. So it does everything to keep glucose as high as possible. And your body unfortunately can't maintain that for an extended period of time.
Absolutely. And so that's another thing I'm actually going to kind of dabble into, like the type of exercise, right? So I'm huge with weight training and getting your cardio through that, right? Like a circuit training, doing 3 exercises back to back maybe, and then take a rest. Like I like getting your heart rate up that way. We're not meant to be running or cycling for 45 minutes straight, because back in the day, hunter and gatherers, that means you're being chased by something, right?
For sure.
And so that's your stress hormone is going to go to the peak. So, that's what, if you love running and that gives you your calm, your like mental sanity, that's awesome. And you can keep doing that. You're probably fine. But for people who don't exercise and they think, I just need to start running. No, I would not recommend that. I would recommend, why don't we just take it easy, go to the gym twice a week, start with that. Like, don't kind of just try to jump in and start running a mile every day for 5 days when you're going to injure yourself.
Oh, for sure. And that's what we see with the metabolic breath analysis too. You can see what fuel source patients are using during an active test. And, of course, I think, like you said, that misconception of, I'm a harder exercise, I must be burning more fat, is actually the opposite. Like
exactly.
It's called zone 2. So it means that your heart rate is it's different for everybody, but most of the time, it's not an intense exercise. It's usually like a walk. For a lot of people, it's going to be a walk, even at a low incline. But getting your heart rate in between like 90, 100, we can tell where your body's burning the most amount of fat. And then once you start getting into more anaerobic, so you start exercising harder, your body switches over to using carbs as a fuel source. So then at that point, anaerobically, especially the high intensity, if you're pedaling or running really hard, your body's not burning any fat at all. So like resistance training, definitely love it. Your body's going to use the most amount of glucose, while it's exercising anaerobically. But for that low intensity exercise for burning fat is definitely the most beneficial for sure.
I'm so glad you touched on that. Thank you.
You're welcome.
So what's the next peptide that we would recommend? I know DHHb, right?
Yeah, so
that one's very good for mood and stress.
Yeah, technically it's not a peptide, but
okay.
Magnolia bark they've been using for centuries when it comes to mood and anxiety. But the one thing they noticed with magnolia bark is sometimes it took like a week or so before you started noticing some of the anxiolytic effects. So they hypothesized, it was probably a metabolite. Well, they found it was the honokiol, more specifically the dihydrohonokiol with the most anxiolytic effect. So that one specifically works on the GABA receptors, the chlorine channels, just like benzos do, but you don't get all the side effects of benzos. So you don't get the motor dysfunction, you don't get the dependency, the withdrawals, but
hallucinations.
Yeah, you don't get any of the bad side effects with the synthetic benzos like you do with the DHHb. So the DHHb is a great natural compound that patients can use. Usually recommend 1 to 2 capsules up to 3 times a day. It's dosed at 15 milligrams, so you can use it, and it has a quick onset of action, like 10, 15 minutes. So patients that are going through like a stressful situation, or even right before bed, a lot of patients, their mind just kind of races right before. They're thinking about all the things that happened during the day, all the things they have to do tomorrow, and they kind of just sit up anxious, Yep. So that's definitely a great product, to use for that as well.
And I've had a patient, I did give it to her. She was going through a stressful time and she took it during the day. And I was like, look, it may or may not work right away. And so she took it during the day. It didn't really work, but she goes, but I am sleeping better. And she was so happy. She's like, it does. It just helps my mind just turn off at night and I'm able to go to, just go to rest,
For sure.
Yeah.
And then, I do have some providers who, they'll ask like, oh, what if my patients are already on benzos? Of course, we try to get those patients off of it for sure. But if patients are taking it very intermittently, that's something you can easily substitute. Like, hey, try the benzo. But if they're taking around-the-clock benzodiazepine use, that's something that, even if they weren't on the DHHb, is something that's a slow process, and you have to make sure that you're very careful with that.
Right. Yeah. So, and then another reason why people are not losing weight?
So the second reason why, and it's probably one of the biggest stressors, is like sleep disturbances. When patients aren't sleeping well, it's going to cause an increase in HPA axis, but just how circadian rhythm and sleep, the delta sleep help manages your immune system. When you're not sleeping well and your circadian rhythm is off, it causes a low-grade inflammatory state in patients coupled with high HPA axis. So, also what this affects when it comes to thyroid stimulating hormone, decreased testosterone production. There's many metabolic disturbances that are happening when patients aren't sleeping well.
We strongly recommend our patients know their sleep. And Deanna and I both wear Oura rings. We love them, but there's many different biometric devices out there. And it's amazing when people look at their data and they think, oh, I get 8 hours of sleep at night and I sleep great. And then they're actually, no, you don't. You don't hit deep sleep, or you wake up 20 times throughout the night.
For sure.
Yeah.
Yeah, and I got 3 little kids, so like sleep is the one thing I struggle with for sure, for 3 and a 1-year-old. So like, that's something that I could definitely improve. And a lot of patients realize it as well, especially when you start getting like the Oura ring and stuff, you can easily track that stuff. But yeah, so when it comes to, circadian rhythm in general, there's a couple peptides that we can use that will help reset your circadian rhythm so that patients, either if they're traveling a lot, jet lag, just some things that cause that circadian rhythm to be disturbed. We have one in particular, it's called vasoactive intestinal peptide, so it stands for VIP. And it's like a 28 amino acid neuropeptide that helps regulate that circadian rhythm, can help reset it. So if it is off, you have to take you can take between 1 and 4 sprays, all done before 3 p.m. So generally recommend like 2 in the morning, 2 at lunchtime, and then you might have to play around with it for some patients in particular, but it kind of helps reset that circadian rhythm and that natural melatonin release at night, so patients should start falling asleep better.
Okay. How quick does that take effect? Like, do you have to do it for a few days before it kicks in?
Yeah, sometimes it does take a couple of days, even a week or 2 before you can fully reset someone's circadian rhythm, especially if they're like traveling a lot, things like that, or having a lot of issues with, or just don't have good sleep environments. So like some non-pharmacological things we talk about when it comes to sleep is, making sure you don't eat, like try to eat, not eat 2 hours before bed, don't drink, blue light before bed, good sleep environments, so no TV, dark and quiet. So that always definitely helps. Sleep is so multifaceted. Of course, sometimes one thing isn't going to do it. So you have to be doing those other things as well. But the VIP can definitely help.
And people can look up sleep hygiene recommendations online,
sure.
And there's lists of things that we recommend. You hit on most of them.
Yeah, for sure.
Absolutely. All right. What's number 3?
Yeah. So some natural products that we have available, like L-theanine and ashwagandha, great products. Ashwagandha has been studied in patients with insomnia and without, but it helps show to improve sleep in those patients. That one does take a couple of weeks, before you may notice some benefit, but it's been studied extensively, been used for a long time. L-theanine as well helps. It's more like on the anxiolytic side, helps patients calm down, help initiate some sleep on that side. Even like low doses of trazodone can be beneficial as well. And we do have a compounding pharmacy that'll make all three together, so it helps patients fall asleep, but also improve their sleep quality. It's been extremely beneficial. And with the trazodone, at low doses, the half-life is only like 3 to 6 hours. So we don't generally see that grogginess or drowsiness in patients the next morning. If you do, you can just decrease the dose a little bit, even lower if you need to, but it's been, that combo has been extremely beneficial. And even doing like the growth hormone secretagogues, so like sermorelin at bedtime has been, that growth, stimulating that growth hormone IGF-1 axis has been shown to increase delta sleep in patients. So
I'm a huge fan of sermorelin. I mean, we used to have the CJC ipamorelin, but sermorelin works just as well, I have found, and people don't realize like they have a problem. I noticed they're like, I'm like, oh, we're doing this because we want to build muscle, right? So sermorelin is a phenomenal peptide in the sense that it can help you reduce body up to 5% body fat and build muscle at the same time. Whereas the opposite of these other like GLP-1s, like, so when I have people who don't have much to lose, but they want to tone up, we start them on that.
Body composition wise, it's fantastic.
It's great.
Anabolic to muscle, catabolic to fat. It also helps with collagen type 3 production, so your skin will feel better. Cognitively, you'll feel better. Just it's great all around.
You're
peptide.
sleeping better. Like you recover better from your workouts.
For sure,
I definitely see the recovery and the endurance with the workout too. I like that. People can go a little longer, go a little harder, and then they're not sore necessarily.
Exactly. Yeah. So fantastic. But just that delta sleep helping decrease some of that inflammation from patients just not sleeping well for that weight loss resistance. So, but the other pleiotropic effects as well. So the growth hormone secretagogues are fantastic. So, that's another one that we really like to add for patients. It doesn't help them fall asleep, but when they do sleep, it helps them sleep much better.
Yes, awesome.
So, the third reason, that a lot of patients, and unfortunately sometimes they don't really recognize that they're having issues, is gut health issues. And it's funny, when we see patients, I'll ask them, like, how often do you have a bowel movement? And they go, once every 3 days. It's like, well, that's not normal. Well, my doctor said that was normal for me. Like, no, that's not. I had one patient say a week, and it's like, oh my God, like, that's horrible, So I think some patients don't realize, like, that they need to be having a bowel movement every day. And like, even sometimes just asking that, you can really see when patients are having issues. But when you have gut health issues, when it comes to your microbiome being off or having gut permeability issues, how that causes inflammation in the rest of your body. When you have gut permeability issues, something called LPS, which is that lipopolysaccharides from gram-negative bacteria being destroyed, and when they get destroyed, the outer membrane gets released to the rest of the body, causing inflammatory issues. And that inflammatory issues causes that insulin resistance, where patients then have trouble losing weight. So, besides that, you also have zonulin being released, from the gut, causing inflammation, antigen trafficking. Like, your gut is like where all the inflammatory things
Everything.
start.
I mean, it's the second brain, right?
1,000%, yeah.
Your immune system lies there. I mean, it really controls everything.
It really does.
And many people think it's as easy as just taking a probiotic and it'll fix everything. And
no, unfortunately, there's probiotics, there's prebiotics, there's postbiotics. There's so many things that you can do to help when it comes, and there's different, like I said, different aspects to the gut microbiome, to the gut permeability, so, and those go hand in hand, those two there for sure.
Right. And so let's talk about some of the things you recommend to help heal the gut, because we also do, we test food panels for your immunoglobulins. And then we also, we like to put people on L-glutamine to help heal that junctions, but there's some peptides that do that too.
Oh, for sure.
Yes.
And one of them that we really love, it's almost like a mainstay in a lot of our gut health protocols, is going to be the Larazotid. So it's anti-zonulin antagonist. So what it does, it helps block that zonulin, because that zonulin will go to the tight junction cell and disassemble it, causing gut permeability issues. So it blocks the zonulin from being released, closes those gaps up to decrease gut permeability. And that one there has been fantastic. Not because they're actually it's been studied in phase 2 and phase 3 studies in patients with celiac disorders. Patients, so they put them on gluten-free diets as well during that time, but seeing a remarkable decrease in like patients with having either flare-ups and increasing their quality of days of life while they're on Larazotide with celiac disease. But I see it being beneficial, anecdotally in clinic, almost in any kind of gut health related issues. I mean, they also studied it in patients with COVID. They studied it in children. It was at Mass General Hospital up in Massachusetts, where they took like 4 children, they gave them Larazotid, and then there was 22 children where they didn't, and they compared like the antigen spike levels after. It didn't decrease the amount of time that they were in the hospital, but it saw like the antigen spike clearing went from 1 day in the Larazotide group to like 5.5 days in patients that weren't on Larazotide. So how it helps block that highly inflammatory viral particles from being released into the body. So that's, love Larazotide in many different aspects, just besides celiac disease, but almost any kind of gut related disorders.
Wow. Another one that I love is BPC. If you would touch on that, please.
Of course, yeah.
Yes.
So, BPC is fantastic when it comes to decreasing inflammatory markers in the gut, but also healing the gut lining. So when it comes to either ulcerative colitis, any kind of lesions, does a fantastic job at helping increase angiogenesis, so increasing new blood flow to those areas and those tissues that have that trauma, and it helps prevent new ones from forming as well. So it does a great job. It also does well too with if you have patients with like lower esophageal sphincter issues, can help tighten that sphincter. So it might be causing some gastro reflux and things like that. It can help with that as well. And in the gut, I love seeing it in combination with KPV in particular, another peptide. So KPV blocks one of the main inflammatory cytokines that we see in the gut, tumor necrosis factor alpha. It also has some can decrease mast cell activation as well through that tumor necrosis factor alpha. So, you have the BPC healing the gut and the KPV decreasing a lot of the inflammatory cytokines. They work really well together.
And what people don't understand is the tumor necrosis factor alpha is actually, I guess, that's the most studied one when we're talking about autoimmune conditions, right? And so we truly believe that having a bad leaky gut dysbiosis is what leads to the systemic inflammation and can lead to the autoimmune conditions.
Oh yeah, for sure. Go hand in hand.
Yeah. And people don't realize that, gut is linked with skin conditions. I mean, even psoriasis, which is an autoimmune condition, right? Even eczema can get cleared up. Like so many mental health issues, like sleep. Sure. Your gut controls everything.
Yeah, they're using Larazotide and they're studying it in like rheumatoid arthritis, for patients, in particular. Right. I see providers will use the oral BPC, and I wouldn't say children, but young adults, that are thinking about going on like isotretinoin or going on Accutane, for acne issues. With let's try BPC first, and 85% of the patients like clear up and don't have no more acne.
Oh my God, I love hearing that, because I beg my young patients not to go on Accutane.
Side effects are horrible.
Absolutely. Oh, yeah. You have to. They're monitored monthly for a reason.
Oh, exactly. Yes. Elevated LFTs, the dryness, in the females, pregnancy issues that you see. So, yeah,
it's just so harsh.
We're seeing such a huge rise in autoimmune conditions now. And it's all because everyone's gut is unhealthy.
For sure. And it has to do with the food that people are eating and things like that. Good, good supplementation with, peptides and other supplements can definitely help mitigate those, diseases for sure.
Can you briefly touch on the whole prebiotic, probiotic, postbiotic?
Yeah, so prebiotics are essentially like the good food to help maintain good gut microbiome. So either oligosaccharides, xylo-oligosaccharides, complex sugars that the bacteria can use that they've studied to help promote good bacteria.
And an example of those?
Yeah, so lactulose is something that providers have been using for a while to help, at low doses, because in high doses you're going to get diarrhea. So low dose.
We actually use it as a treatment for constipation when people have to go.
Yeah, for sure. Lactulose for sure. So at low doses, it's going to be beneficial for a prebiotic, but also pentosine polysulfate is actually, it's a pentosyl oligosaccharide, so it's very similar to a xylo-oligosaccharide like xylose, and it's been beneficial in helping promote good gut microbiome.
So that's not technically a peptide then? I always
thought
it was.
Yeah, it's not technically a peptide. It's actually like chemically similar to heparin, but it has like 1/15 of the antithrombotic activity, but it has all the benefits when it comes to anti-inflammation, has some antiviral activity as well. It can be used for allergic rhinitis in a nasal spray. Yeah, it's has a lot of great effects as well.
Awesome. And then, so those are prebiotics.
Mm-hmm.
So whenever people get a over-the-counter probiotic and it says with prebiotics, or when they get I think Benefiber now says with prebiotics. So what are...
I mean, it's probably some kind of oligosaccharide. It could be xylose.
They're just putting that in there.
Probably,
Okay, that makes sense.
Which could definitely be beneficial in it. But it's of course that's dose dependent as well, making sure it's a high enough dose, because the xylose you have to do a pretty high dose. It's like 750 milligrams per gram or per kilogram of the patient. So it has to be pretty high.
Yeah. Okay. And then we know probiotic.
Yeah, I know, and you guys really hit on this with Elise and the gut health one. So making sure there's different kinds of strands when it comes to the lactobacilli, Akkermansia, bifidus bacteria as well, but just helping support the beneficial bacteria in your gut.
What's the number of bacteria that you recommend for your patients?
I try to get it, if it has 25 billion. I know some of the combo ones, some will be higher than the other.
Right. There's so many.
There's so many.
And I usually recommend like 10 or more bacteria.
Yeah.
Like 10 or more and then 25 billion or more. And like, yeah.
Yes.
We ask Elise this, and it comes up often. What do you recommend, with food or without food for probiotics?
I usually generally recommend with,
right. So it's metabolized.
Exactly.
Yeah. That's what we think too. All right. And then what's a postbiotic?
So a postbiotic is usually like a short chain fatty acid. So something like, your body, the gut microbiome will already convert these over, and it's usually like butyrate, acetate, or propionate. But butyrate is the big one that we generally recommend, just because with its effect when it comes to maintaining good gut barrier, because it helps increase mucus production, but also helps increase the amount of tight junction cells that your body has. So, but your body, if it doesn't have a good gut microbiome, it's not producing butyrate to the colon as well. So butyrate supplementation is very important when it comes to, butyrate is like the main energy source for your colonocytes, like 30%. But it helps with fat oxidation in the gut, in the colon in particular. It actually help increase certain, your own GLP-1 peptide, your own peptide YY, and leptin as well. So, some appetite suppressing peptides are increased when you have good butyrate production. So there are some,
But you can also take butyrate, like you guys have.
Yeah, we do have a butyrate.
Right? Okay.
Yeah, and that's what
So for people who aren't quite there yet, but their gut's not ready, we could maybe. Would that help jumpstart getting their gut functioning properly?
For sure. I generally recommend, like you said, if someone's like, oh, I'm going like every other day, maybe not every third day, not as bad, maybe you might suspect some slight gut dysbiosis. It's a great one to start with. And when it comes to butyrate, there's some sodium butyrate products out there. Unfortunately, they kind of smell bad or taste bad. But we generally recommend the prodrug version, the tributrin, because it does have increased absorption into the colon. Because sometimes the regular sodium butyrate can get caught in the small intestine and might cause some issues there, GI side effect wise. And we really want to make sure it gets to the colon. So the tributrin, it's a cholesterol backbone with 3 butyrate molecules, and it survives in the stomach and gets to the colon where it needs to.
Wow, awesome. That's another thing, I'm glad you kind of just touched on that. People don't realize when your gut's not functioning right, you're having malabsorption. That's the whole point of leaky gut, malabsorption issues. And so when you're taking medications, they may not be making it to the area in the gut of which they're absorbed in a sufficient time, or you might, like if you're on blood pressure medications, it could be labile from an absorption issue.
Sure.
And we know with the medications, the GLP-1 and GIPs, they slow gastric emptying. So the medication could be sitting in the stomach a little longer, right?
And that's what I've seen. We've had some patients too. They put them on BPC that have had gut issues. They actually gain a little bit of weight because they're actually absorbing the food that they're eating. So I've seen that as well. Just because you're fixing some of the gut health. Yeah. So
then you got to step back a little bit and reapproach like what they're eating, right?
Exactly. It's like, I used to eat the same. Well, you have to eat a little less now because you're actually absorbing it, than you were before.
You're actually getting the nutrients you're putting in your body.
Exactly.
All right. So what's the fourth thing we have to look for?
Yeah, so it's just patients is being in a chronic inflammatory state. Obesity causes low-grade inflammation, which causes insulin resistance, which then perpetuates that cycle of not being able to lose weight and just being in a chronic inflammatory state. Unfortunately, when you're obese, it causes increased adipose cell death, which will cause inflammatory markers to be sent into the adipose tissue as well. And then that increased size of adipose tissue from having increased storage of triglycerides will cause infiltration of inflammatory markers and cells, just causing more inflammation and causing insulin resistance. So
once again, it's another hamster wheel.
Exactly.
More inflammation creates more inflammation.
Yep. So, and then of course, inflammation too, either from autoimmune diseases or other, sources, that cause insulin resistance. So, we have some great, compounds that can definitely help. And one that a lot of people using low dose naltrexone can definitely help when it comes, as a toll-like receptor. So it attaches to the cell itself, inhibiting a lot of that inflammatory response. So not, you can use it. I mean, it's been studied, and when it comes to fibromyalgia, IBS, it's, used in a bunch of different use cases, but it does have some beneficial effects when it comes to decreasing inflammation, which will decrease insulin resistance. And then we also see it as well. It has some effect on decreasing LDL in patients. And we think it has to do with increasing lipolysis by just kind of mobilizing fat cells a little better by that decreased inflammation.
Oh, that's quite interesting. We've been using LDN for, thyroiditis, like autoimmune thyroiditis.
Hashimoto's disease.
Hashimoto's.
Mm-hmm.
Yep. And I've seen it work. I've seen it in a few like compounded weight loss medications where I've done it then. And, but yeah, that's very interesting.
Yeah, for sure. And then the second one that we like to use a lot of is called amlexanox. Mm-hmm. So that one inhibits some inflammatory kinases. So not as high as the receptor on the cell, a little further down, but it does great. It's called, it inhibits 10 kinase binding 1 and inhibitory kappa kinase in particular. So it inhibits the kinases that cause that, the transcription factors to release inflammatory cytokines. So it blocks it. And it's been extremely beneficial. And
so you're blocking the more inflammation, right?
Yeah, exactly. Blocking inflammation so that your body has a chance, when it decreases that insulin resistance, your body has a chance to uptake glucose and burn it efficiently. So then it starts using, fat as a fuel source. So they studied it in patients with type 2 diabetes to see if it'll decrease their A1C. And it was like 45 patients, but they saw in like 33% of the patients that dropped their A1C by like half a point. But in those patients that responded, they had higher inflammatory baseline markers. So, they called them responders. So those patients who had high inflammatory markers responded better to the amlexanox than ones who didn't.
Wow.
So, yeah, so we see it work well in those patients, along on GLP-1 therapy. Either they may have other autoimmune issues or they're having inflammatory issues. You can add amlexanox in there and help kickstart their weight loss program.
I read that it also affects non-alcoholic fatty liver disease.
Yes, they've been studying in that as well when it comes to, it helps activate AMPK, that fat metabolism pathway, and then it also helps increase GLUT4 translocation as well. So, yeah, it's been studied in NASH and on.
Right.
Now it's Maffeld.
Yeah,
yes,
exactly.
They changed the name.
For sure.
And how do you take amlexanox?
Yeah, so it comes in a 40 milligram capsule. We recommend one capsule 2 to 3 times a day. Some of your more severe patients maybe have to take it 3. Most patients do well at 2 before meals. And the side effect profile is extremely well tolerated. It even has pregnancy category B, so if you wanted to use it in those patients, it's safe. But even at doses 4 or 5 times higher, it's been beneficial on the side effect wise. You're not going to have any side effects to it, and it's really well tolerated.
Wow, awesome. Well, I think this has been very informative. Is there anything else out there that you want our audience to hear? I mean, by the way, we're going to have you back on it because this was amazing.
No, for sure. Thanks. I'm definitely looking forward to that as well. But, we also have some great supplements. We call them peptide enhancing supplements, specifically when it comes to adding these along either your GLP-1s or other therapies. I know we talked about the BPC, KPV. We have that available as a supplement called Gut Tides. But some other supplements that we have for your weight loss journey, one in particular is called Leucinergy. So low doses of leucine have shown to decrease the amount of NAD needed to activate AMPK, which is that fat metabolism pathway. It also has resveratrol in it, so low doses of leucine and resveratrol have been shown to increase SIRT1 activation. So it's a great combination with GLP-1, so patients can stay on lower doses, increase their weight loss, but also when they're on lower doses, decrease their chance of side effects. So that one's been extremely beneficial with a lot of our patients when it comes to either starting GLP-1 therapy. Sometimes providers will add it in when they plateau. Patients will plateau at some point, add it in to hopefully, instead of increasing their dose, It's like, hey, let's add this supplement and see if we can make it more efficient. And then getting your patients off GLP-1. So it's like, hey, they're not going to have appetite suppression anymore, but at least their fat metabolism doesn't fall off the table as well. So that, it's been beneficial on that side.
And that essentially, like you said, so it essentially makes your body use your own body's mechanisms.
Yeah, so it's going to help the GLP-1 be more efficient, but yeah, it's going to make the NAD. So NAD is that coenzyme that's an activator in a lot of metabolic processes. It makes that threshold for the amount of NAD you need cut in half.
Wow.
Yeah,
that's great.
Yeah, so and then we also have, maintaining muscle mass is something we talked about earlier. We have a product called iCell, which is like 5 grams of creatine, 5 grams of valine, 4 grams of glycine, 3 grams of glutamine, and 3 grams of leucine in it. And we recommend drinking it throughout the day to help with hydration, because GLP-1s, besides decreasing their appetite patients, it also decreases their thirst. So they're drinking less water, and hydration status is super important when it comes to inhibiting proteolysis and maintaining muscle mass in those patients.
How's that come in a powder form?
Yeah, powder form. So I recommend putting in like 1.5 liters, 2 liters of water with ice and drinking it throughout the day.
So I'm going to kind of question this part. So with the creatine, I've always read that you need to drink it right away for absorption. But is this because it's with all the other?
So the bioavailability of creatine monohydrate has been studied extensively. It's like 99%. It's excellent, And I think when it comes to our product, we're more with all the other osmolytes or the amino acids that acting as osmolytes. We're just worried about hydration status. Yeah, if you wanted to do an extra 5 grams of creatine all at once, like I love creatine. It's my favorite supplement. I do it. I do 5 grams of creatine in the morning, and then I drink my cell throughout the rest of the day.
Preaching to the choir. I think I'm going to get this stuff. I'm ready for it.
Yeah. So and then it's just the differences between the iCell in particular, like a regular electrolyte, or everyone will ask about either electrolytes. Usually those move in and out of the cell very quickly, but this is a sustained increased cell volume, which will inhibit proteolysis, increase.
And you already said they're amino acids. These are I'm a big proponent of the branched chain amino acids and essential amino acids, and a lot of times people are not getting these when they're decreasing their calorie intake, and that's another reason why we're losing muscle.
Exactly.
And I have everybody going on this, so I am ordering this immediately.
Yeah, for
I love
sure.
it.
It's fantastic, and also even if you're not on GLP-1, just increasing your exercise capacity and performance, it's a great product as well.
And as you said, hydration. So many people get dehydrated with being on the GLP-1s as well and GIPs. And a lot of people just don't drink enough. And I also am a fan of putting trace minerals in the water as well to help with metabolism and whatnot. We're filtering too much stuff out. So I like the idea of this better than the electrolytes, like you said.
Yeah. And then the last one is our citronol LNA. So, low doses of leucine have shown to decrease the amount of nicotinic acid needed for a normal niacin dose is usually 1.5 grams. You only need 75 milligrams of nicotinic acid to get the same cardiometabolic effects. So, some patients, we definitely see reduced flushing. Some patients are sensitive; they'll still get the flushing, but a lot of patients don't experience it. And then citronol, which is a combination of nobelatin and tocotrienols, which are polymethoxylated flavonoids that help decrease. It works on the same pathway as statins, so HMG co-reductase, instead of it being an inhibitor, it's an enzyme that breaks it down. But we see great reductions in LDL and ApoB in our patients, either in combination with GLP-1s or just alone, because sometimes you have those patients, they're losing weight, they're doing well, but their lipid panel's still way out of whack, and this is a great product, because you don't get the elevated LFTs, you don't get the myalgias that like we see with statins. So, we call it our statin replacement. It's been a great add-on, especially with tirzepatide. If you have someone who's really resistant, that GIP component helps increase white adipose tissue storage capacities. So you decrease that ectopic lipid spillover, so you see less, LDL flying around holding that cholesterol.
All right, what's the name of that one again?
Citronol LNA.
Okay, and how do you take that?
It's going to be 3 capsules. You can either take it in the morning or at night.
Okay.
Like if someone's sensitive to flushing, I don't recommend it at night. I happen to be one of those people, and I took it and I woke up at 1 a.m, flushed, and I was all hot, and I was like, all right, I take it now I take it in the morning. And it can, the flushing can definitely be reduced after you take it for a while. But yeah, I dropped my ApoB by I dropped it by 60 points in 2 months.
Wow.
Yeah, it was
great.
Yeah.
That's another one. All right, I'm making note of these.
Yeah.
I love it.
Fantastic.
Awesome.
Yeah, so on the weight loss side, those are definitely some. We have some other great supplements as well, for peptide included, like dihexa and stuff like that. So if you're looking for that, providers or patients, we have that available.
Well, like I said, we're going to have you back because you are a wealth of knowledge. I loved having you on. Thank you so much. Can you tell our audience how they can find you or the pharmacy, New BioAge?
Yeah, so New BioAge, we're the education company and supplements. We do have a partner of pharmacies that we work with. We generally try to, we work with a bunch of great providers in there, you guys being one as well. So, I mean, if you definitely want to get in contact with me, I'm on Instagram, I'm on socials as well. So you got, I'm not hiding anywhere, but, of course we definitely recommend we like to, recommend our providers for those things. So if you need anything, of course, we're available. You can call the New BioAge phone number and either myself or one of our other pharmacists will get back to you, but we really like that interaction to be with with our providers.
Awesome.
Yeah, that's great.
And I'll attach maybe your Instagram and whatnot. People can get
no problem.
some advice from there.
Yeah, for sure. That's the one thing. Unfortunately, a lot of longevity medicine and stuff in this space, they're taking the providers out of it. A lot of people are going straight to the consumer, and we don't believe that at all. Like, we want to empower our providers because, when you guys make the recommendations, it's just so much more impactful than someone trying to feel like they're marketing to people, trying to convince them on something. So,
and everybody's an expert these days,
yeah,
right?
Exactly.
It's hard to do this on your own.
Yes.
For sure, 1,000%.
All right. Thank you so much.
Thank you. I appreciate it.
The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.